Gauden Galea, or Gao Li, his Chinese name is, who is the WHO representative to China. Dr. Galea, welcome to our program.
Thank you, Tian.
Thank you so much for sharing your time. I know you have a very hectic schedule these days. Tell me more about the latest assessment of WHO of the outbreak of coronavirus right now as we speak, sir.
The numbers change all the time, and there are new updates coming up every few hours, but in broad round figures, we have reported about 24,000 cases, about 3,000 of whom are severely ill, and about 500 of whom are people who have died. So the situation is of a important disease of significance, of public health significance. It has been declared a public health emergency, which means that all countries need to get ready for it. At the same time, the mortality rate has settled to around 2% of known diseases and of known cases, and that is a far lower number than it appeared at the beginning. So while it is a disease that is capable of severe forms and protracted, even life-threatening disease, it is not as deadly as it was originally thought when it was first recognized.
Yeah. We have seen a sharp difference between what is happening in Wuhan, the epicenter of the outbreak, and elsewhere in China. The cases in Wuhan are still increasing in quite big numbers, but elsewhere the increase has slowed down in terms of percentage. So, Dr. Galea, how should we understand the situation, Wuhan versus the rest of China, and of course, the rest of the world?
Wuhan has been the epicenter. The epidemic clearly started there, and part of the numbers that we see is an artifact of the initial recognition and the initial spread. The initial definition of the disease centered around more severe cases, which were easier to recognize. You have to understand that this epidemic started in the context of seasonal influenza, where it was masquerading as often as a milder form of disease, like influenza or the common cold. So the recognition of milder forms was not possible at the beginning, and it was more easy to focus on those conditions that were similar and serious. The initial case definition, therefore, identified more severe cases and therefore people who were at higher risk of dying. As the numbers are, as the condition is better understood over time, we are able to identify milder cases on a broader spread. And this has allowed a better understanding both of the lower risk of dying than originally was thought, also a better spectrum of severity.
Right.
And as the milder cases are identified, the pattern does emerge that most people who contract the virus will suffer from a more self-limiting form of the disease. Part of what we are seeing, therefore, is the fact that Wuhan had spread before the milder form would have been recognized. Other provinces are luckier than that because they can be more prepared and more ready. And this broader definition.
So
over to you, sorry.
So Dr. Galea, since you talk about Wuhan vis-a-vis the other part of China, help us to understand how did the WHO, from the very beginning you were informed, to today, you've been working with the Chinese side, and information-wise, and also in terms of cooperation, inspections. By the way, I know you just came back. This is your first day out of quarantine after your latest visit to Wuhan. So tell me more about this timeline, how WHO was informed, and how you've been checking on the information and the latest prevent and control situation. Dr. Galea.
I will broadly summarize it without going into too much detail, but the Wuhan provincial government, the Wuhan government issued a notice, a public notice of the recognition of a outbreak of a cluster of atypical pneumonia at the end of last year. Specifically on the 31st of December. We were immediately alerted by that, entered into a rapid discussion with the National Health Commission, and shortly thereafter, on the 3rd of January, our own office met with the National Health Commission, and there was an international notice under the international health regulations. Since then, the progress has been on a number of lines. We have had regular meetings with the National Health Commission. As we record this interview, my next appointment on my calendar is actually to attend and to listen to one of these technical briefings. So we have, as the National Health Commission has compiled the data and is able to provide a new milestone of understanding, we get that delivered to us, and we are able to spread it through WHO. On a daily basis, the government has been providing the latest updates on numbers of cases and contacts being identified. Equally importantly is the laboratory side, where within days of the initial recognition of the cluster, the virus was identified, and by early January, I repeat, within days of the recognition and notification, there was the release of the genome sequence that identifies uniquely the virus and allows scientists around the world to start developing test kits.
I see.
Later, China has also released the probes and primers that are used by the technical specifications that allows other countries to be even faster in the development of the reagents they need in their laboratories. So that has been the style of daily updates of basic data, milestone updates of improved understanding, and clinical and laboratory updates as that information is collected by China.
Dr. Galea, many people are interested in knowing, what about the human-to-human transmission? When does WHO know about that possibility, at least, with this latest outbreak? And how you've been coping with that, and how you've been cooperating with your Chinese side, or interacting, if I could use another word, about that?
Yes. So a virus becomes of concern when there is sustained human-to-human transmission. And for quite a few days into the epidemic, that was not clear. For example, in the very first cluster, it was either people who had an association with the Huanan seafood wholesale market or contacts of those people, stallholders and workers inside the market. There were already a number of cases that were not associated with the market, and so the suspicion that some human-to-human transmission had taken place was happening very early. But then between that and sustained human-to-human transmission, it is a technical question that's very difficult to answer, and especially the investigation of clusters gives us some clusters of cases gives us some understanding that this might happen. Indeed, the clearest understanding was still not there when the emergency committee first met to consider whether there was a public health emergency to be declared. And it is very well known that the experts from around the world, considering the evidence, were somewhat evenly divided in is there or is there not. It is only towards the end of January that evidence had accumulated, including by some examples of clusters of transmission that had happened outside the country. And that was one of the core elements that precipitated WHO to declare an emergency, a public health emergency of international concern.
I see. Dr. Galea, when you say about the measures taken by Wuhan, because you were there in January, tell me about exactly Wuhan has been doing it, and how should we see the pros and the cons of the measures being taken so far? We understand the city has been concealed, there has been traffic bans, and people inside Wuhan are not supposed to travel out because of concerns of spreading of the virus. But on the other hand, there were people criticizing whether it is respecting the human rights of the people inside Wuhan. How do you, from your perspective, going inside that city and also as a health expert, see this issue?
I have to say that my visit and my team's visit to Wuhan happened just before the controls about travel in and out of Wuhan happened. So even when we were there, we even saw how the airport was operating its exit screening, and the operations of the airport and the train station, for example, were still very much ongoing. Our lasting impression of Wuhan is of the dedication of the workers there. Not only the epidemiologists and the laboratory scientists who had been involved in the identification of the cases, the cluster, and in defining the response, but also the dedication and the cautious optimism of the clinicians that were processing people who had fever, and were doing this in large quantity. We visited Zhongnan Hospital, and in the 2 weeks before we visited, they had processed 2,000 people to identify out of them 13 confirmed cases. So we must admire the dedication of the workers and respect the sacrifice of Wuhan and other cities that have gone into this sort of social distancing exercise in order to try and interrupt transmission. We understand, as from the evidence point of view, that social distancing, reducing as much as possible the numbers of contacts between people, is an extremely promising way of controlling and breaking the transmission. It remains to be seen how effective that has. It is safe to say that this will, to a high degree of probability, have reduced the peak of the epidemic. It will mean that eventually the numbers that could have happened without such measures would have been far higher than the numbers that we actually will be seeing when the story is told and when the epidemic ends.
But what
Pros
about
and cons?
Pros and cons, please go ahead, sir.
Whenever you do a dramatic public health intervention such as this, one always has to balance the personal freedoms versus the public health imperative. When you do surveillance, you have to look into people's data to understand who they are and what type of disease. Normally, this is data that people hold confidential, but it must be shared between the workers in order to be able to analyze the patterns. People's freedom of movement, people's ability to function and work in society are curtailed. And so against that and the economic impacts that will result, one then balances the public health greater good. One of the things that we can see is that the actions taken in Wuhan and in China as a whole have been recognized by WHO as having contributed to the protection of global health. We are seeing cases outside China, but it is safe to say that without the measures that have been taken, both locally as well as nationally, we would have seen a much larger spread.
But what about, Dr. Galea, the people from Wuhan to the other part of China already? Now there has been also very strict registration measures being taken, as well as various cities and localities in China looking for those people coming out of Wuhan. So what do you make of, once again, this balance that you just beautifully touched on?
One needs to understand that now it's important to not artificially label people, because that could lead to a sense of complacency. What do I mean? If one looked at this as a Wuhan problem or even a Hubei problem, then one could artificially relax one's attention. So not only is it important for us to practice solidarity, and to avoid stigma, but it's not just because it's a nice thing to do, but because if we label the disease as being an issue of Hubei or of Wuhan, then we forget that now about 1/3 of the cases that are reported are outside Hubei. The issue is importantly to be seen as a China issue, and we should respect Wuhan and Hubei for the sacrifices they have made, but keep our vigilance up across the whole country.
On the other hand, Dr. Galea, it is China that is now facing the outbreak of the coronavirus. However, we have also seen panic around the world and also some of the overreactions, as the WHO illustrated, to the not yet pandemic. What do you make of the latest situation and even mistreatment of Chinese and people who wear face masks elsewhere in the world? We've seen increasing numbers of stories like these recently.
The declaration of the public health emergency did not come with any travel or trade recommendations. In the same way as I have spoken about pros and cons in Wuhan, travel and trade restrictions are a double-edged sword and have an impact on economies and have an impact on an opportunity cost in the health system itself. Therefore, it is important that every country has its sovereign right to make its own public health risk assessment and to decide what actions it will take to protect its citizens. It is important to understand that these, under the international health regulations, should be commensurate with the public health risk. They should be short in duration, and they should be reviewed regularly in order to ensure that the harm that comes from the restrictions themselves is not greater than the benefit that they are trying to achieve. WHO did not make any travel or trade restrictions based on the evidence that is available, because it understands that there are ways in which countries can protect themselves through increased surveillance, through increased laboratory and clinical readiness, through appropriate risk communication with their populations. So the balance has to be reached between the overall costs to the global society, global economies, and the public health risk. Hopefully, over a short period of time, a balance will be reached that is reasonable and minimizes the cost.
Has WHO, on the other hand, Dr. Galea, providing advice to those countries what WHO consider as overreactions or already reacting in a way as if it were a global pandemic, because WHO already said it very clearly it is not yet a global pandemic?
Under the international health regulations, WHO is empowered under Article 43 to receive from the countries concerned their public health rationale. It will be assessed by WHO, and communications will go back to the countries concerned through, again, the internal peer review that is offered by the international health regulation. WHO does not have the power to judge or to decide on an individual country, but it can point out what are the alternatives that there are, and it can provide an assessment to those countries on the appropriateness of the public health rationale. This is well within the agreed international health regulations.
I see.
And that is a process that is already ongoing within WHO.
With what countries can we share here?
Of course not. This is the international health regulation is a peer review within the process within the network of international health regulation focal points.
I see. Another point is WHO has vowed, as a result of announcing fake, to help those countries with weaker healthcare structures. One could think about the African continent, for example, or elsewhere in the world. Tell us about the latest efforts being made so far, how you've been coordinating, and what help have you provided, how to avoid the spread of the virus to these parts of the world. Dr. Galea.
And I'll take this, if I may, as the last question. Tian.
Okay.
So the number. So WHO has mobilized a network of experts around the world. We have immediately the alert came to us. The same day we had a 3-level incident management team set up with coordination between headquarters, the regional office in Manila, and ourselves in the country office. This 3-level team has continued to operate, and it's one of the most recent manifestations of that is the Director General himself, as well as the Regional Director of the Western Pacific region, coming to China to really represent a 3-level discussion about both what China is doing and what are the implications for the rest of the world. WHO has already on its website a very rich set of resources, has collected all the evidence from China, all the findings that are probable guidelines based on other coronaviruses such as SARS and MERS, from the input of a large number of scientists, has now produced a set of protocols that cover everything from lab protocols, from clinical management guidelines, home care, surveillance protocols. So there's a large list of guidance that countries do not have to replicate for themselves. This guidance is being updated on a daily basis as soon as new information. WHO has collaborated on modeling studies. It has released its blueprint for research and is fast-tracking candidates for or seeking to fast-track any candidates for vaccines, for therapeutics, for testing. So on the basis of a global effort, there's a mass mobilization of scientists and of public health experts to assist countries. Now that the public health emergency has been declared, all the country offices, like my own peers in other countries, are working with ministries to get their own readiness plans, how to strengthen their surveillance, how to prepare isolation units, how to achieve good supply of personal protection equipment, how to train their nurses, how to communicate the risk to their populations. So this is now happening on an international level.
Yeah. Dr. Galea, I know you are running out of the time for this interview. Final
Yes.
advice from you, final words as well for our audience watching our program today. Latest advice for them to protect themselves and their loved ones.
Thank you for giving me this chance. With every emerging infection, at its very beginning, there's no vaccine and there is no treatment. So we have to base ourselves on the behavioral response. And this has been so throughout my career. I remember more than 30 years ago when AIDS first broke out. There was no treatment or hope of a treatment, and all the advice that we were giving has been behavioral. And so has it been for all the emerging infections since. It's important today to understand that the power to reduce risk is in your hands, literally. Hand hygiene is the hand itself is the deliverer of the vaccine, of the virus to the mouth, the nose, the eyes. Scrupulous hand hygiene, avoid handshaking, avoid the contact with surfaces that might be soiled. Food hygiene, respiratory etiquette, use your elbows to cover nose and mouth if you're coughing and sneezing. Social distancing, reduce the number of meetings that you have with people, whether avoidance of crowds, avoidance of physical meetings in offices. If one can reduce these numbers of contacts, we have a great chance of interrupting transmission. And finally, if you use masks, use them correctly. Do not reuse disposable masks. Do not fidget about the face because the mask itself can then become contaminated with your hands. And make sure that your surgical mask is disposed of after every use. Our control, our hopes of stopping the epidemic now lie very strongly in keeping social distance and observing personal behaviors.
As long as we could get hold of a mask, of course.
The mask is not an important part. This is a very, in WHO's understanding of the evidence, our review of the evidence, is the mask is most needed when someone is sick, and they should wear the mask to protect others from their sneezing or their coughing. It is not an essential part of the response. Of course, it does help if everyone is wearing a mask, because then everyone is protecting everyone else. But it's very important that if one does not find a supply, because many are running out of stock, this is not a cause for panic.
Dr. Gauden Galea, thank you so much for sharing your very precious time at this important time of a coronavirus outbreak in China. All the best to you and your team here in China. Dr. Gauden Galea.
Thank you so much.
Thank you, sir. WHO Representative to China. Bye for now, sir. Thank you. Really appreciate it.
Bye-bye.